The time is just gone 9 minutes past 6 p.m. on the Iftar Drive this afternoon. And we're going across now to be joined by Dr. Angelique Coetzee from the South African Medical Association. We're talking about the predicted COVID-19 third wave in South Africa and also looking at India's new variant. And we are led to believe that has been deadly. And is there cause for concern of this particular variant, of this particular strain of the virus in South Africa? Dr. Angelique Coetzee, good afternoon to you and welcome to the show.
Good afternoon, and a very good afternoon to all your viewers out there and those that is listening.
Thank you very much. Well, Dr. Coetzee, obviously, we touch base with you from time to time to get regular updates and to get an understanding as to where we are as far as this pandemic is concerned. And looking at South Africa, we've experienced a second wave, and we are now heading into the winter months. We can feel the cold, we can feel the chills, and I can see you warmly dressed as well. So, obviously, in anticipation of winter and this third wave, where are we? What are the experts saying, Dr. Coetzee?
The experts are predicting the third wave very soon. We think it will start to emerge, especially from next month onwards, as we then will be in our winter months. And it's not the weather itself that is the reason, but because of it's getting cold and people tend to come together. They do not open the windows. There's no natural ventilation. And then obviously the masks. People are tired of wearing the masks, don't understand how important these masks are for your own health, the safety for other people around you. So we were worried about the Easter weekend. But since the Easter weekend, 2 weeks later, we haven't really seen low numbers. So the last week and a half, the numbers started to rise very slowly. Yesterday, I think it was the first time that we had under 1,000. But you have to understand, the stats is saying that for every one that you diagnose, you miss 30. So if you look at it from that point of view, we are far from out of the woods yet. We can only claim victory if there was for a whole week at least 0 cases. We haven't seen that in our country yet, and that's a big concern. So if you look at the modelers, they predicted that it would be Gauteng, Free State, and the northwest province that would be hardest hit. But again, it's predictions. The predictions is also saying that they don't think the numbers will be that high as in the second wave. But it all depends. It depends on the variant that we're going to get. It depends on whether it's the same one. For now, we know that the people are saying that NICD says that they don't, or they haven't yet said that the person who is currently being tested for the Indian variant has got the variant. They're still waiting for the sequencing of the test, and that takes quite some time. The thing is, whether he's brought the Indian variant to South Africa, the B1617, or not, I think because our borders are open, we can safely say I think it's already here.
Mm. Yes, I think obviously this is where the risk is at this point in time. And also, when one looks at what has happened in India at one point in time, they were basically in their comfort zone and says, the numbers are low. So, and when one looks at now the variant and what it's doing at this point in time, extremely deadly. And it's the same with us, Dr. Coetzee. We cannot retreat into a comfort zone and say, our numbers have been low and, we're just going to take things for granted.
Fully agree with you. We have a weekly, the SAMA is on a weekly on a Saturday morning, very, very, very early in South African time. We have a meeting with the Indian Medical Association, Taiwan, Singapore, Canada, and Pakistan, all of them. On a Saturday morning, we come together. And this past Saturday morning, they predicted that they will only see the peak next month in June. So it's quite concerning, and it's really a problem. If you listen to our colleagues in India, and this is now from doctor to doctor, what we are, we are quite a big group, nearly 20 doctors from representing our various medical associations. And it seems to us that it started with a social, there was meetings held, as well as the elections that got a super spreader, that in the end became a super spreader event. And this is why we keep on saying, please stay away from other people, groups of people gathering together. And in South Africa, again, as I've said, people doesn't want to wear their mask anymore. They don't want to hear anything about COVID-19. And that's when it's going to catch us. We're not going,
Yes.
I can't see that we will not get a third wave. Highly
Yeah,
unlikely.
but also I think, Dr. Coetzee, what is important to understand is preparedness for the third wave.
Yeah.
And when one looks at what is happening in India, totally unprepared at this point in time, and that is why we've seen this dire need for oxygen. We've seen other countries now roping in, helping, and the country is basically crying out for help in terms of hospital beds, in terms of treatment, in terms of oxygen. In every way whatsoever, we can see that India is hopelessly not prepared for this latest surge or this latest wave.
You're absolutely correct. Remember what happened with us during December and January. We also actually ran out of oxygen. A lot of the hospitals, especially the public sector hospitals, ran out of oxygen, and some of the private hospitals as well. So if we don't prepare, and I haven't seen a lot of preparation going on, maybe it's behind the scenes, but I don't get this urgency, this thing of to say, what are we going to do? Are our personnel better equipped? Are the hospitals better equipped? I haven't seen that urgency. Maybe it's happening and we're just not aware of it. But it feels to us that we will handle the crisis once if we are in the crisis. It's not right.
Well, definitely. And just as we head towards the winter months, obviously, we flu and then flu-like symptoms as well. And often, one is concerned in terms of flu-like symptoms, which are similar to the symptoms for COVID-19 as well. And I think this possibly could be a major cause for concern, where people could confuse the two in terms of having COVID-19 or the flu.
You are absolutely correct. Remember, last year in June, we had strict lockdowns. So we didn't see flu. We didn't see colds because people were all confined to homes. So it made it easier for us to make that diagnosis. Now we're out of that system. We are on a level 1. And the flus and the colds are coming in. And it is difficult. It's very, very difficult to distinguish between a mild COVID-19 and flu symptoms. It is really difficult. It's not as clear-cut, the symptoms and the clinical picture, as it was in the first wave. Already with the second wave, we had difficulties that didn't present the classical cases. Now, on top of it all, as you correctly said, we have the flu virus coming in. Very much the same. And, if you've got flu, or a severe cold, and I asked you, can you smell? You're not supposed to be smelling to be able to smell, because that's the part of the normal coronavirus that causes flu and colds. But unfortunately, it's exactly the same for the COVID-19. The other problem that we are sitting with is the PCR testing. So if you test too early, if you test before 7 days, I can get a false negative test. If I test too late, after 2 or 3 weeks, I can get dead virus and falsely make the diagnosis that's positive of COVID-19. And then on top of it, if you are on a medical scheme, they will only pay for one negative COVID-19 test. So how many times am I going to test you during the winter before I pick up what it is? So we are really in a problem. I predict problems going forward, especially now that we are on level 1. And that is what it is. We cannot go back to level 5. Can't.
Yes. Now, what about our GPs, Dr. Coetzee? Are they sufficiently geared to assist people in making the right decision, in terms of testing, whether to test, not to test, whether you've got flu, whether you've got COVID?
We try very hard and to advise the people. But it seems to me that everyone wants to have COVID when they got a flu. So everyone wants to be tested. Now, again, as I've said, it's very, very difficult to test you, because if you test at the wrong time, I'm going to get either a false positive or a false negative. And I can do actually nothing with that. And again, the costs involved. So in the private sector, is the cost involved. In the public sector, I'm not sure whether they test everyone. And if they test everyone, you have to understand that PCR test has got a cold chain that needs to be administered to. So if they don't use the cold chain, and then by the time it gets to the lab, you will also not be able to get a decent picture back. The only way that we can currently, the stats that we can trust currently, is the stats of the people admitted to ICU in the private sector, because their stats are correct. The hospitals are quite religious on reporting to the COF system. It's not the same with the public sector. And as I've said, outside the GPs, we cannot test everyone. We cannot. You cannot afford, after 3 tests, that you're going to start to pay 800 Rand out of your pocket every time. It's a lot of money. Economically, the people are getting very, very, it's difficult. There's not enough money going around. They cannot afford to test the whole time for COVID-19, get it back negative, maybe because we tested the wrong time.
Well, Dr. Coetzee, thank you very much for that, and for your time, as always, with us here on Salam Media. We wish you all the best, and we do appreciate you taking time out and talking to us.
Thank you so much, and to all your people out there, thank you so much.
Dr. Angelique Coetzee from the South African Medical Association joining us this afternoon. We're going to go for a quick break. We come back. We still have got quite a bit to cover on the show this afternoon.